M1400, patient dyspneic or short of breath. When is a patient dyspneic or noticeably short of breath? This item is classified as an outcome measure, and the item is not only scored for your agency as a component of value-based purchasing, but it is also data collected for the agency's star rating. The time measure in which this indicator is collected is at start of care or resumption of care, and again at follow-up discharge from agency. To collect this data, you may utilize an interview approach with the patient and caregiver when the patient experiences dyspneic episodes. A review of the patient history and physical may also prove helpful. Medicare's intent for this item is to identify what activities result in the patient becoming short of breath. If the patient uses continuous oxygen, the clinician should assess the patient while using oxygen. If the patient uses oxygen only intermittently, the clinician should assess the patient without oxygen. The responses are based on the patient's use of oxygen, not the MD's order. The responses for this indicator are arranged in most optimal to increasing severity of dyspnea. Select response 0, if applicable, if the patient has not been dyspneic. Response number 1 is applicable if walking more than 20 feet, climbing stairs, demanding bed mobility, or demanding transfer activities causes dyspnea. Response number 2 is applicable with moderate exertion, for example, walking less than 20 feet while dressing or using a commode induces dyspnea. Response number 3 is applicable with minimum exertion, for example, while eating, talking, or with agitation, and that produces shortness of breath. Response number 4 is applicable if dyspnea occurs at rest. When assessing this indicator, pay careful attention to the time period to ensure accurate data collection. For this indicator, the day of assessment is defined as 24 hours before the home visit and the time in the home. To assess if the patient has experienced dyspnea, utilize a combination of observation, interview technique, and review the patient's health history.